This is AP Med. My name is Andrew Poveda, and today we are interviewing Dr. Veronica Jacome Lopez. She is a fellow at Montefiore Einstein, training in critical care. She also did a residency for internal medicine at Englewood Hospital. She is a non-US IMG. So let's hope to learn a little bit more about her journey in Ecuador and how she got to the position that she's at right now. So, do you want to cover a bit on your background and introduce yourself a little bit? Like any
Sure.
hobbies, like where you come from and things of that nature?
So, hi everybody. My name is Veronica Jacome Lopez. Everybody has difficulty with my last name. I actually have two last names because in the Hispanic culture we have one last name from the father's side and one last name from the mother's side.
Mm-hmm.
So actually my last name is Jacome, the first one. However, through the years, everybody has a lot of issues with my last name. So right now everybody knows me as Veronica Lopez, and I'm also okay with that as well. I'm from Ecuador, a very small town that is Quito, that is the capital of Ecuador. My background by itself, actually all my family comes from a very small town in Ecuador that is Píllaro. It's a very poor area in our country where the majority of people just survives through selling milk or working on their lands. So it's a very poor area of our country. And then I was born in Quito, Ecuador. Through the years, I studied medicine in Ecuador, in Quito, and then I went to United States where I studied at Kaplan for maybe 2.5 years, because this has never happened to me before. I never had the idea of going and studying medicine in English again. So in Ecuador, we study medicine in Spanish. Everything on my mind is in Spanish. So going through a lot in order to change Spanish to English, I had to be involved in a center where we could be exposed to the step 1, step 2, step 3. So that's why I went to Kaplan. After that, I started my residency at Englewood Hospital Medical Center, that at that time was related to Hackensack University. I know that now I think it's going to be related to RWJ, but at that point it was with Hackensack University. And then at this point I'm doing my fellowship in critical care at Montefiore Medical Center with Albert Einstein College of Medicine.
Do you wanna touch upon kind of your journey of how you started up over in Ecuador first in medical school, and then you ended up coming over here to study for residency? How was that process for applying to residency out of medical school in Ecuador?
So it's actually pretty difficult. Back home, here in Ecuador, we do not talk about that too much, especially because you go through medical school. In Ecuador, medical school is 6 years, and I think the majority of the countries is like that, where you do 6 years of medical school, including an internship year, and then you have to do something that we call the social service year, where you do or you practice medicine in very rural areas and poor areas of the country.
Okay.
And then that would help you to do, for example, a residency in your own country. That means, in Ecuador. However, the majority of doctors, have applied to different countries outside of Ecuador, because Ecuador by itself, we don't get any payment when you're in residency or fellowship. So basically, even though you are working in the during your residency years, you have to pay for the university. The hospital doesn't pay you at all. So it's pretty hard. So that's why the majority of people actually try to get out of the country. And the countries that are the most common ones are Spain, Mexico, Chile, and Argentina. Mm-hmm. Especially because those are the Spanish-speaking countries. It's very weird. And you don't, it's not very well spoken to go to United States, because it's not as common, right? Like I said before, we are trained in Spanish. Our mind, everything is in Spanish. So doing this Spanish to English to Spanish is or Spanish to English is very difficult. So that's why I feel the majority of doctors go to Spain or Mexico. Now, on my mind, actually, my initial thought was going to go to Mexico. I really wanted to go to Mexico. But I don't know how. Things happened for a reason. And at that time, I had my ex-boyfriend that right now we don't even talk to each other. But his brother was doing surgery in Texas. So between things or whatever, he was we were already over a year. And he was let's go and visit my brother. And I said, sure. So we went to visit his brother in Texas, and that was actually my first time in the United States, where I saw like the hospitals. I think it was San Antonio. So I saw like the big hospitals. I saw like the pagers and stuff like that. That things looked like Grey's Anatomy, and I was like, oh, this looks like very cool. So I actually remember I went back home. I was in my rural service year. So I went back home and I told my father. My father asked me, like, did you like it? And I said, yes. And he was like, oh, would you do it? And I said, like, it's very expensive. So, I mean, it's expensive to the point, like, for example, the basic salary in Ecuador is like around $400. So paying a plane ticket to United States, trying to live in the United States, trying to apply for the exams there, and being exposed to the medical system would be like a very expensive kind of debt for me. At that time, I already had like almost a year of working in my rural service year, so I had like some money. But like I said before, the amount of money that we earn in Ecuador is like minimal compared to United States. So my parents helped me a lot. Like I said before, I had like two options. I could have like prepared myself in Ecuador for the step 1, step 2, step 3, and like then travel to United States or travel to another country where I could like apply for the exams. Unfortunately, Ecuador doesn't have like, I don't even remember the centers where you go and do the exams. I don't remember the name of the centers right now. But like Ecuador doesn't have those centers. And the other option was like just going to United States and like being exposed to the language, being exposed to the system, being exposed to more people that were like studying like me. So my father helped me a lot.
Wait, I don't mean to interrupt you, but you said that there's like exam and like test centers that you could take it outside of the U.S., like in other countries?
Yeah.
Oh, just Ecuador didn't have it in that case. I didn't.
Yeah, I don't remember the
that,
test centers. What is the name of the test centers?
I don't know the name.
The name where we do the step 1, step 2, step 3.
I can try looking
Let me
it up.
see. Yeah.
Oh,
yeah.
It says Prometric Test Centers.
Yes.
Oh, okay.
So once you go into medical school, and like, for example, when you're in medical school, you will see after you do I think it's like your second year of medical school, you guys will have to do the step 1. The step 1, and then you have to do the step 2, and then you have to do the step 3. All of these tests are done in the Prometric Center. There are some countries that actually have a Prometric Center area where you go and you do the test outside of the United States. Yeah. Ecuador doesn't have it.
Okay.
So that's why at the end my father like helped me a lot, like economically and like mentally and like a lot, and he gave me the money so I could like I was able to go to Houston. I was in Houston in Kaplan studying for like the steps. Why? Because I already passed like 7 years of the medical school, but like the 6 years that are like all those years, plus the rural medical service year. So talking to me about like the Krebs cycle, the mitochondrial tank, the mitochondrial diseases, and all of those things, it was like studying medicine from scratch, completely from scratch, but in English. So I feel like this situation was pretty hard. I don't know how many times I really wanted to just like stop and go to Europe and Spain instead of United States. I feel like the step 1 was like the most difficult exam I've ever done in my life. Wow. But I also think it was because after like I did already medicine for 7 years, and now I'm trying to relearn medicine again, but from like the molecular part and the biochemistry part, pretty basic things that we are not exposed in the majority of the Latino medical schools, kind of thing.
Oh, okay.
So step 1 was pretty hard. After step 1, we have like the step 2, where in my time it was divided like on the step 2 CK, that is the clinical knowledge, and the CS, that was the clinical skills. The clinical skills at that time was like you were interviewing with like a couple of patients, and like they rate you how you do and stuff like that. I think after the COVID hit, they removed that step 2 CS, and right now they have like other forms for the step 2 CS. I think the name is OET. Oh. I'm not very aware of that, but they removed it. Okay. But on my time, it was a step 1, a step 2, like I said, divided into 2. That was the clinical skills and the clinical knowledge, and then the step 3. So after I was done with everything, then I applied for residency. So it took me, if I graduated in 2015, if I did a rural service years in 2017, it took me like almost 3 years for me to apply and like do all the exams. So it was basically like studying medicine again in English. It was pretty like disturbing because I was so used just to have my own money, to like work in the ORs, to like have doctors next to me all the time and do things, and then being exposed to be like, oh, I'm in medical school again, but now in English. So actually in Kaplan, you meet so many people that are going through the same path. So you see so many people that until now I'm friends with them, that I feel like from the 100% that we were at that time, maybe just 70% made it, and then the other people just went back to their countries or went to another countries to try it because it's pretty difficult. Oh. For us, it's very difficult. We are international medical graduates, but we are non-US international medical graduates. So we do not have like a green card or a visa. So even for us to apply for residency or fellowships, our scores really matter. Yeah. Like our scores really matter. We need to have, if we really want like very like a strong residencies like neurosurgery, plastic surgery, you need to have like a lot of background and like research. Yeah. At that time, I didn't feel like I needed to do any of that because I was like tired already. And I'm pretty good at like talking to people. So that's what I decided to do, internal medicine. So I applied to internal medicine. I remember at that time was like when COVID hit. I just had 2 interviews, just 2. And my scores were actually kind of good for internal medicine. Yeah. So I just had 2 interviews. But like I always said, you just need one. That's all. You just need one interview. Yep. So I matched into residency at an Oakwood Hospital Medical Center, where I did my 3 years of residency there in New Jersey. I love that hospital. Like that hospital has absolutely everything. It's a small community hospital, but we didn't have like any fellows. So we were exposed to do many things. Mm-hmm. And that's how I fell in love with the critical care unit. In the critical care unit, we didn't have any fellows. So basically it's like the attendings and you. So like to do central line, Shiley catheter, is like arterial lines. To do any procedure, you were the one doing it with the attending. So I felt like that was pretty good at that time because I was like, oh, this is very nice. Like I really like the critical care unit. And that's how I ended up applying to critical care. Actually, when I was in residency, I did over like 20 articles, like trying to do a lot of research as much as I could because I already knew like I am an IMG. I am in a small community hospital and I want to do critical care. So I need a strong program that could take me. And that's how I did like a lot of like case report. I also did like case series, a lot of research during residency. Yep. I ended up like in multiple different kind of like research societies, and I went like to chest conferences that are like chest, SGIM, and maybe like 5 or 6 conferences that were like around United States, Hawaii, Colorado. Where else did I go? New York, but like different areas. And I feel like that actually helped me a lot because you can like network and like know more people. Mm-hmm. Then I applied for critical care. I feel like all those things that I did during residency over like the papers and everything helped me a lot. And I think I just applied to maybe like 40 programs because I just wanted critical care. I never wanted bone crit. I just wanted critical care. Mm-hmm. I prefer my patients like when they are very unstable and trying to help them. Yeah. So me personally, I don't like the clinic and I don't have patience for the clinic. Like to be talking and asking, how are you doing? Are you using your inhaler? I cannot. I'd rather have like everything pretty fast. So that's how I just decided for critical care. Mm-hmm. There are not just so many programs for critical care. I feel like there are maybe like 50 or 60 that take like IMGs in all the United States. Okay. So I think I applied maybe to 30 programs. And from the 30 programs, I got like maybe 18 to 20 interviews. That's a lot. And I ended up at Montefiore Medical Center. Right now I am a second year fellow. Mm-hmm. I am one of the chiefs. I am the wellness chief. I love Montefiore. Like I feel like the experience that I had during my residency, like doing the lines and doing all the procedures has helped me a lot. And actually I can compare my residency then and then with the residence that I have right now. And at that time when I was in Englewood, I was like, oh, I wish I could be like in a university hospital because like, you know, the name of a university hospital. Yeah. But now that I'm in a fellowship and I'm like, I'm so grateful that I was in a community hospital Because in a university hospital, the place that I am right now, the residents do procedures, but not as much as I was able to do. Why? Because you have a fellow. So the fellow will take over. We will take over about like the procedures or the intubations of the things. While when I was in residency, I used to do absolutely everything with the attending. So I feel like that is something that people don't talk a lot. And that is something that you should take into consideration before applying for residency.
Okay. I'm still a little bit like strung up on the test centers thing. So couldn't you technically go to a closer test center? Like let's say there was a test center in like Panama or somewhere like before you get to the US. Couldn't you do that so it's like cheaper, right?
Yeah. So yeah, you can do that. But like I said before, there are many people that decide, for example, to study on their countries. Like, let's suppose you are in Ecuador, you decided just to study in your country, and after you feel like you are ready for the test, then you can go like, I don't know, Peru. I think Peru has it, or Colombia, or Panama, or any other places, and then come back to your country. That is a very good way to save money, actually. But in my case,
Yep.
I am, how to explain this? I am pretty like, I cannot stay quiet. I cannot stay just like in one position. So when I was back home, when I was in Ecuador and trying to study at the same time, because I was pretty good with my hands, I used to help in the OR a lot. So I used to be like surgical assistant with the surgeons. So they used just to call me and be like, yo, let's come, we're gonna go for a surgery. So instead of like being focusing on studying, they just called me and I used to like just leave everything and go for surgeries or to see patients or to see procedures. So that's why in my case, especially, I was like, no, I cannot stay on my country to do this because I wish I would have like the energy to be like, okay, let's just stay quiet and don't move and like start studying.
Yeah.
But I didn't have it. And also my father also always told me like, you need to be exposed to an area where like everybody speaks English. Like I said, like Ecuador, English, like nobody speaks English. Like it's something that you learn in the school, but it's like the basic thing. So like the medical terms, the medical, like everything that is on the books is like completely different from Spanish than English. So my father was like, I think like you should go and like start also to do like trying to be exposed in the system by itself. Remember also that us as international medical graduates, we have to be exposed for like observerships or rotations. So somebody can give you like a letter of recommendation and apply for a residency. The letters of recommendation are kind of like difficult to get. So it's like you have to email everybody, ask for help. So I feel like that also helped me. That was a plus that I was in there because imagine if I would be like back home asking for like, I need a letter of recommendation and they would be like, okay, come. And I'm like, oh, I'm in Ecuador right now. So,
I mean, isn't everything like kind of like online now, right?
I mean, I feel like the letter of recommendation, I feel like they need to see how you work and how you do.
Oh, yeah, of course.
Exactly. So there are like different things, right? As an international medical graduate, non-US, if you put like a rank of list of how difficult would it be for somebody to enter, I feel like the most difficult to enter into residency is the non-US international medical graduate. That means people like me, Ecuadorians, Peruvians, people that are like not American citizens.
Yeah.
Because we have to go through like different kind of like filters to get into a position. Like, how are your letter of recommendations? How is your scores? Where are you from? Are we going to give you a visa or not? Do you have any like backgrounds? Like all of those things matter. After that, I feel like we have the US international medical graduates. For example, people that are like born in the United States, but they went for medical schools because it's cheaper to Grenada, to Barbados, to Jamaica, because it's cheaper, it's way cheaper. But they also have it difficult, right? Because they didn't do medical school there. Yeah. And then we have the people that study medical school in United States that I feel like the scores for them shouldn't be as stronger as the scores for the rest of us, because you guys did medical school back home, like in United States. So that's why for like an international medical graduate like me, I feel like we have to do absolutely everything that we have in our hands to try to get into a position. It's very competitive. It's very demanding. If you go like to a Kaplan center, where the majority of us, we are like trying to like get ready for our exams, it's like crazy. Like everybody was like on their computer, just like studying. There is nothing like, oh, we're gonna go for a party today. Let's go for nothing. Everything is like, I remember it was like Monday to Saturday from like 6 a.m. to 10 p.m. just like sitting. There were people that used to go to libraries and to study. So it's pretty demanding because of our steps. Like we really need to have highest scores in order to pass that filter. And if you compare, you can see like the highest scores are from people that are non-US IMG. So we can enter into a position.
Yeah. Wait, so you keep referring to like the Kaplan sensors. So was there certain areas that you could study, like these Kaplan centers where you would study with people also studying for STEP?
Yeah. So I'm talking about 2018, so like almost 8 years ago. I think there are still Kaplan centers. So there are different Kaplan centers around all the United States. So for example, there is one in New York, there was one in Texas, there's one in Chicago as well. So I remember before, because I didn't know absolutely anything before going to United States, like nothing at all. So I didn't know any guide of like, what is the step one? I didn't know it was like almost 8 hours of like sitting and like do a multiple choice kind of exam. I never knew that. I didn't know that step 3 were like 2 days of exams. I didn't know that step 2, I mean, I would never know that because you were not like medical school here. They never tell you these things. They never say like, oh yeah, we're going to study for step 1. I feel like there is just one medical school that is Universidad San Francisco. That is like one of the highest university here in Ecuador that like they actually kind of like start telling you how to study and preparing you for the exam. But the rest of medical schools are not like that. The rest of medical schools are like with the idea for you to stay in the country, or like if you are going to go away from the country, go to like the Spanish speaking countries. So I feel like that's why that's the reason that many people do not go like to United States by itself and better go like to the Spanish speaking countries.
Yeah.
So Kaplan is like a very small center with like multiple computers in there, and they have like the books. I don't know if you've ever heard about like the books for step 1. So it's like the Kaplan books for step 1, the Kaplan books for step 2, the Kaplan books for step 3. And of course you have like, there are so many things and books to get prepared for the step 1, 2, and 3. But Kaplan is one of those. So it's basically they are teaching you medicine from scratch in English. And I feel like the majority of people of us who were in Kaplan, we were already doctors in our countries. There were like ophthalmologists, there were surgeons, there were like OBGYNs already attending. But whenever we go to United States, we're nothing basically. So we have to start from scratch.
Wow.
So that's why we had like so many like people in there getting ready for the exams and trying to learn like, oh, the Krebs cycle, the lactic acid, whatever thing cycle. Because like it already happened like several years ago for us. So that's why like these Kaplan centers, like you go and then you have lectures as well, like pretty big doctors. Like I remember Dr. Varone, I think he was like pathology. He will come and he will give you like the pearls for these exams. Like different doctors would come and like try to teach you how to do. So of course, like it was a very expensive center. Yeah. But I feel like that helped me, like first to be in an environment that I didn't feel alone. That I felt like, okay, there were more people struggling the same as me or worse than me, or that are going through the same, like, okay, all of us, we are in the same boat.
Yeah.
And I feel like you can value that, because I feel like if I would be at home and just like seeing my friends, like, oh, one of my friends is in Mexico, another is in Spain, another is already almost finishing residency, and I'm still here trying to enter into a residency program, I feel like that would have been like pretty depressing.
Okay. Yeah. How was it kind of transitioning from moving from Ecuador to the U.S., like from scratch? Like how well was your English per se? And like you said, when you were studying for step 1, like you kind of had to, you didn't know that much medical terminology in English, so you were learning that from scratch entirely. On top of that, you graduated medical school, I think you said 6 years prior, so that was a whole nother process of like relearning everything, like, of course. But how was it transitioning from Spanish to English? Like, what was your proficiency like prior to moving to the U.S.?
So I feel like prior to moving to the US, my parents put me through many like English centers back home, like here in Ecuador.
Mm-hmm.
But like the English is basic. Like you can talk to somebody like the typical, you can have like a small conversation, but you will never talk about like, full medical terminology. So I feel like if I could have like my books, I could show you. I remember like any minimal thing I used to like write above like the words in Spanish so I could understand. Many things I had to translate, and until now my brain is still. So I think I have to do like a double thing. Like before I talk, I have to think in Spanish and talk in English because, like, over 23 years, my brain has still been in Spanish. And every time that I'm in Ecuador, I completely forget English, and then when I'm back home, I completely forget Spanish. So it's kind of like this cultural thing. But it was pretty difficult, and I feel like Latinos by itself, we're pretty close to the families. Like everything is like pretty close to the families.
Yep.
And also like as a woman, Latina, you are single, like going and travel outside of the country is not a pretty well seen. So I feel like at the beginning, my parents had to deal a lot with that of like, oh, your daughter is living alone in the US. So right now it's like better because my parents are like, yeah, and now she's an intensivist. So what? So, but at the beginning, I felt like it was a lot for them as well because like in our culture, I don't know if in Peru as well, but like in Ecuador, there is a lot of like chauvinist or like sexist kind of things until now where like women have to like live with their parents until they are married. It's not very well seen if you travel outside of the country by yourself. So I feel like that cultural environment also like hit me a little bit hard. But then I feel like being in Kaplan, I met a lot of my friends. Actually, one of my best friend is from Kaplan. I met her there, and she's from Guayaquil. That is another city in Ecuador. She's doing pediatric intensive care unit. So we are pretty close, and I feel like meeting her helped me because also both of us were women. So both of us, we went through the same of like, oh, you are living alone in the US. Why are you alone? You are female, blah, blah, blah. So I feel like being both of us together helped me going through all of these paths. And until now, we like, the other day we were talking about this, like, do you remember when we were like studying in the library like at 9 p.m. or 10 p.m. and we thought like we were never going to do this. Look at us now, like we are almost attendings and we are like already looking for a J1 waiver jobs and we are almost done. It took us a while, but like finally we are here. So yeah, I feel like the change was pretty bad. Like it was very difficult, but like I feel like my objective was always like, if I'm here, I'm gonna do it well because otherwise I'm gonna come back home, and I don't want to go back home for like, oh, you didn't do it. So it was hard, but worth it.
Okay, yeah. So wait, so you mentioned that you're a second year. Yeah. Okay. So it's 2 years for critical care, right?
Yeah.
So how is it applying for jobs? Because I know it's something like sometimes hospitals offer you a job like post graduation. Is that how it is over there at Montefiore, or are you applying to other places too, or how does that work exactly?
So the issue is I enter with a visa that is a J1 visa. So right now I'm still on a J1 visa. The J1 visa, they give you a visa for 7 years. Unfortunately, in order to change from like J1 for like residency or green card, you need to do something that we do, a J1 waiver. This J1 waiver right now is pretty difficult to get because like you have to do 3 years of like working in working in an environment that needs your help. So you have to apply for different areas where you can help people. I actually feel like that is almost like my rural service year when I was 1 year. But if I have to compare Ecuador to United States, the rural service year in United States, or like this J1 waiver, is going to be the same as if I'm one of like the biggest hospital in my country. Like that's the difference. You know what I'm saying? Like, United States has like so much technology, so much like people that can help you. Like if I go 3 years in a hospital here, my patients will die. But if I go 3 years in a hospital in the United States, in a rural area, I know that my patients will live because I have the technology and I have everything to help them. So, yeah, the issue is like, as a J1 position, not all the hospitals and not all the universities can offer you a job. So unfortunately, Montefiore Medical Center doesn't have like a lot of J1 position, J1 waiver, because imagine it's like 3 hospitals that are Montefiore, and then they will have to give 1 J1 waiver for like multiple J1 people. So it's pretty difficult. And it's in New York. So New York is not an area that is with poor resources or poor income. So this J1 waiver, it has to be in an area that actually they need you and they need your help. So that's why we have to do the J1 waiver for 3 years. Now, many people have said like, oh, why don't you get married? Oh, why don't you have kids? Oh, why don't you do this? Why don't you do that? When you enter as a J1 waiver, even if you get married, even if you have kids, your status is not going to change. As a J1 waiver, you have to finish, as a J1, you have to finish the J1 waiver for 3 years in order to continue with the process, even if you get married.
Oh, really? I thought once you get married, you kind of, you get the green card or I thought that's how it worked.
No. So, for example, if I would have entered as a tourist visa, if I would have married as a student visa, things would have changed. It would be like, oh, like an immediate change to like green card or like citizenship. I don't even know that order just yet. But like, if you enter as a J1 waiver, if you enter as a J1, that is the working visa, you will continue as a working visa until like you do these 3 years of J1 waiver. Where you do these 3 years of J1 waiver, wherever there is a need for you to be. So, for example, in my case, I applied to different areas around the country in order to have a J1 waiver, and then we go through interviews, and then let's suppose the hospital will say like, okay, we want you. So they will like offer you a letter, and then the issue with this is like there are many ways to get the J1 waiver, and one of the ways is the most common one is something that we call the Conrad 30. I don't know if you have heard about it.
I haven't.
So the Conrad 30 is like a raffle kind of thing, where like there are just like 30 visas to be, or 30 J1 waiver position for each state.
Each state. Okay.
So let's suppose I'm applying to Connecticut in, I don't know, University of Connecticut, I don't know, for like critical care. Okay. So I applied there. They said like, okay, you're going to be an attending here. We are in need in this hospital, so we will help you here. And then they will put my data into like this raffle kind of thing. That is Conrad 30, that are like just 30 visas for 30 people. If I get into this number 20, then I will get a spot there. Okay. But if I am like the number 35, the number 50, then I won't get there because there are just 30 visas in there. So then I will have to apply to another state.
Okay.
So even if you apply, it doesn't mean we have everything safe and sound. Even everything will be fine once the state tell you like, yeah, your Conrad 30 is granted. Now, like I said, there are different other ways to do it, like the Appalachian Trail. I don't remember the other way, but like there are different ways where you can like apply for like a J1 waiver. But the most common is like this Conrad 30.
Okay. Wait,
but this is just for J1 people.
Oh, okay, yeah. Okay, I understand that. Wait, so it's 30 per state no matter how big the state is? Like New York has 30, then California has 30, New Jersey has 30, everywhere is 30. Wow.
Yeah, it's Conrad 30, yeah. And so they try to give it to areas that are like pretty poor and the areas that are like indefinitely need.
Yep.
So for example, they're not going to be, let's suppose we have New York, right?
Yep.
Manhattan is not a state in need. Manhattan, the area by itself, is not an area that is going to need, oh yeah, we need a physician in here right now. Or like a critical care attending in here. Why? Because there are like American attendings that would rather stay there than going to Nebraska. You know what I'm saying?
Yeah.
So the other areas are taken by us. like with international medical graduates that are on a J1 visa.
Okay, so wait, after you complete your 3 years of a J1 waiver, right? What's the process after?
So after that, once you enter into a J1 waiver, your visa change
Okay.
from J1 to H1B.
Oh, okay. Yeah, I've heard of it.
And then after the 3 years of H1B, then you can apply, I think, for like the citizenship and then the green card. But I really don't know about that process because I'm one of those people that live one day at a time. So I'm like, okay, let me find first my J1 waiver and then I will figure it out the rest.
Mm-hmm.
But yeah, it's like a pretty long process. It's not like, oh, I just go as a J1, I get married, and then I switch.
Yeah.
As a J1, you will have to go through like a lot. Like finish your residency, do a fellowship, then try to apply for a J1 waiver in areas of need, where you can also like help and give back to the United States of the things that you guys have helped us doing as well.
Mm-hmm. Wait, so what made you want to pursue a fellowship and not just try to go straight to a J1 waiver? Because so you said that the J1 originally, it's 5 years, right?
Mm-hmm. 7 years.
Oh, it's 7 years.
The J1, yeah, they give you a visa that is a J1 for 7 years. So it's like in those 7 years, you can do residency, fellowship, another fellowship, or another residency, but you have like 7 years for that.
Oh, okay. So that's why in your case that you did residency for 3 years, a fellowship for 2 years, then the J1 gets cut short because you only did a certain that length of 5 years of like residencies and fellowships. So that means that you could have done like another fellowship. Yeah, let's say another fellowship for another 2 years, and that would have been the entire length of the J1, right? And then on top of that, then you again have to apply for the J1 waiver, no matter what.
Yes.
Like, okay, you just like kind of cut it short, but you could have cut it shorter if you just did residency and then went straight to J1. J1 waiver. Okay, I get it now.
Yeah.
Okay.
So there are many people, for example, I have from residency, I have my classmates that like they were also on J1. They finished residency like by the third year. Mm-hmm. So instead of doing any like fellowship or whatever, they were like, okay, I need money, so I'm gonna go and do my J1 waiver.
Oh, okay.
Now, in my case, why I decided to do a fellowship is, like I said, as an internal medicine doctor, you will have to do hospitalist, and also you can do as a PCP, like being outside in a clinic and stuff like that. Unfortunately for me, I have a lot of energy. Like at baseline, I cannot sit still and like just listen to people. I love talking to people. I love like sharing moments with people. But me, my personality by itself, it's more about like crashing people, like what to do now, how can I help them, let's save them, let's talk to the families. Okay. So I feel like critical care has given me that opportunity where like it's a constant fight with it, like people are actively dying and you need to create bonds with like the family members and also with the patients and try to help them as much as you can. So I feel like critical care was the only place where like I could be myself and I could be happy, because at the same time that I'm like helping my patients, my energy is like at the top of everything. So it's like things don't stop, things keep happening.
Yep.
And that's why I decided to do critical care.
Okay. And okay, so when you did internal medicine residency and then you did a fellowship in critical care, what's the difference in like cases and like the things that you could do in terms of if you instead did an emergency residency? Yeah, an emergency medicine residency instead. What is like the levels and like what could you have done if you did the ER residency compared to what you're doing right now? Like what's the difference?
So the internal medicine residency is actually, I have a lot of respect for them because first of all, they're in the emergency department all the time.
Yeah.
So they will see absolutely everything. People that come from like, oh, I have pain on my back for the last 2 months and it's nothing, to people that come like, oh, I have chest pain for the last 5 minutes or 10 minutes and it's like a heart attack or is like aortic rupture or aortic dissection. So they will see everything and then they will have to triage it like, okay, this is just the flu, or this is a typical pneumonia, or this is ARDS, or the patient just needs antibiotics and can go home, or the patient is going to crash and is going to need ECMO. So I feel like the ED, the emergency department, has like many things to be like taken care of at the same time. But because you have so many things to take care of, you need to ask for help. That means if they have like a crashing patient, that means like somebody that came like very difficult, having difficulty breathing, having chest pain, having like, they have to intubate, they have to start pressors, they would stabilize the patient, like they will intubate the patient, they will have the patient to maintain them alive. But because they are pretty busy with like 20 more patients that are waiting for them, they cannot manage them completely. So then the ED has to ask for help, right? So then we'll ask, critical care, come please and see this patient that is like intubated on multiple pressors. Or like cold surgery. Oh, this patient has necrotizing fasciitis. They need to go to the OR, or they have this, or they have that. So I feel like the ED has like so many things to do, but they need to ask for help because they don't have the time, unfortunately, in this environment, to be taking care of each small thing. Now, in internal medicine, though, we are the people that we will see the patients inside of the hospital already. So the ED is like, oh, this patient is sick, but doesn't look that sick, like to go to the intensive care unit, but doesn't look that good to go home. So you take care of them.
Okay.
So then internal medicine comes and take the patient to the floors, or like hospitalize the patient. We will give antibiotics, fluids. We will check the patient every day and see how stable they are. That is the level of internal medicine, right? Like we stabilize the patient. And then I feel like critical care is like one of the highest levels, if not the highest. Because like if your patient is already intubated, if the patient is already with medications to help them being alive, for the blood pressure, to breathe better, if you send these patients to the floors with internal medicine, the patient will die. The patient will need, first of all, in the intensive care unit, even the nursing ratio, sometimes it's 1-to-1 or 1-to-2. If you see the ratio of nurses in the emergency department or the nursing ratio in the internal medicine floors, it's terrible. Like sometimes in the ED, there's like one nurse for like 6 or 7 patients. Sometimes on the floor, there's one nurse for like 8 or 10 patients, because those patients are more stable kind of thing. But in the ICU, you need sometimes like how it should be like 1-to-1, like one nurse to one patient. However, to be realistic with you, sometimes we don't have that amount of personnel. So sometimes we have like one nurse for like 3 patients. But it's different to have one nurse for 2 or 3 patients than one nurse for like 8 patients. You know what I'm saying? So the care in the intensive care unit is different, completely different from like the rest of the teams, because we take care of the patients when they are at their worst. So when they are like actively dying and the other services, there is nothing else the other services can offer, then we will have to take over, try to stabilize them, and then ask for help as well. So if we notice like the abdomen is getting tense, it's peritoneal, do we need to talk to surgery? We call surgery, please come evaluate the patient. They will have to take to the OR. But in order to do all of those things, they need to have a patient that is alive, right? So we need to keep the patients alive until they do the rest of the things. So I feel like in the intensive care unit, there is a lot of like teamwork, because everybody helps each other. We have like the nursing, we have the respiratory therapists, we have the PCAs, you have the residents, the fellows. If you need help, if you need dialysis, you need to call renal. If you need surgery, you need to call like the surgical team. So, and like I feel at the moment that you are calling for a consult, once you say this is critical care, the person will be there in the next couple of minutes, because they know it's extremely aggressive. Like the patient is going to die if they don't come as soon as possible. But like I said, the ED, you could have just, and that's why I didn't choose ED, because like you could have just like, oh, it's a nail pain because somebody hit them, or oh, the patient is having a cardiac arrest because it was a STEMI. Now also working. Exactly. So now also working in the intensive care unit, we have the majority of our consults are from the ED department. So every time I go to the ED, sometimes they're like, oh my God, why you guys didn't do this? Let's order these labs. But then like once you're in there and like take a minute and see the amount of people that we have is like way too much. We're in the Bronx. So the amount of patients that we have is like extremely high. So I understand also my ED colleagues, like they don't have, the time to be thinking completely about what's happening with the patient. So they will like stabilize the patient, help the patient, see that the patient is stable, and then advance to another level. That level would be house, that level would be like going to the hospital, or that level would be like, okay, the intensive care unit. So I feel like that's what the DA struggles a lot, like trying to see how sick is the patient and asking for help, and then the rest of the teams we would have to help them as well. But yeah, they're like, ED people are like way overworked. They have to do so many things.
Yeah, I never thought of that perspective of someone, like a patient coming in from the ED could have something as simple as a simple cold, but you see cases specifically that people are like really in need and in critical care, and they need to be treated immediately. So yeah, there is that separation and difference of which patients gets treated for what specifically. Yeah. All right. So
have you watched The Pit?
Yeah. Actually, I have watched The Pit. Yeah, there's a new season coming out in a couple of days.
Yeah.
Yeah.
It's exactly like that.
It's a good show.
It's exactly like that.
Okay. I'm glad you say that it's exactly like that, because I hear it's like really realistic to how it actually is. So I like to see that comparison at least. Yeah.
It's exactly like when I saw The Pit. When I watched The Pit, I was like, oh my god, this is like the most realistic show. Like you have people that are just coming for like alcohol withdrawal, or are coming for like, oh, I'm hungry and I need a sandwich, and then you have the other part of like, oh, the patient came walkie-talkie saying chest pain, and now the patient is dead. Let's do chest compression. So that's how the ED works, and then they're trying to send patients to the floor or to the ICU, and there are no beds. So basically, that's how it works.
Okay. So you're Ecuadorian. What's your favorite cultural dish? Could be a dessert, appetizer, main meal.
Encebollado.
Encebollado.
Encebollado is like a hot soup. Like that has fish inside. Could be tuna, or could be like another type of fish. But it's like, it's delicious. I feel like I don't know if it's the first or the second soup around the world. But even when I have like after my 24-hour shift, or if I haven't eaten anything during my 12-hour shift, I will be ordering an encebollado. It's delicious.
Okay. And what is your favorite thing about New Jersey, and what's your favorite thing about like New York City, or specifically even the Bronx? Like, what's your favorite parts about both parts?
I feel like New Jersey is pretty calm. I used to live in Englewood Hospital, like around Englewood area. I love that area. It was like pretty calm. My parents went to visit me with my grandparents, and they used to like walk around. There were deers around, like everything is around flowers. So it's pretty calm and quiet. So I love that about New Jersey, and I really miss that. New York is crazy. I love the city. There are like so many things to do. The city never sleeps. But sometimes it's like, okay, I need to be quiet. I live in an area that is Yonkers, so my apartment is like right in front of the river. So I love like, after all the craziness in the Bronx and like the hospital and everything that is happening, I just go back home and like see my river, and it gives me like so much quiet and peace.
Do you have any advice for pre-meds, or even people like non-US IMGs that want to get to the position that you're at right now? Like, what steps that they should take, or something that you wish you knew along the journey?
I wish I could have started studying for the steps while I was in medical school. So, for example, when I was like already on my second year of medical school, I wish I had like the idea I was going to come to the United States. So I would have like start studying for the steps instead of waiting like the 6 years and then studying for that. That is one of my like recommendations. Like if you're planning to go to the United States, and even if you're not planning to go to the United States exam is like so difficult. The USMLE is like so difficult exam. Like if you are ready for that exam, you are ready for absolutely everything else. So if you want to go to another country to do your residency or whatever, just study for the USMLE, and I assure you, you will pass any other exam. Like it's pretty like intense, and it will get you ready. And once you enter into medical school, I would recommend you to start studying from like day one. Like keep studying, keep learning. It's nothing like, oh, I need to learn all the book, but like the most you understand a topic, it would be the easiest for you later in order to do the exam. And I also always think like everything happens for a reason. So just go with the flow. Like things are always meant to be. If that is your journey, and you will be there. Like things are meant to be, and everything in life is temporary, for good or for bad. all the tears, all the judgment, all the depression, all the sadness of being away from home is gonna be temporary, because one day you will have the money and you will have the time to be traveling back and forth like I do, to come and see my family every time that I can.
Okay. And if you didn't choose medicine as a career, what would you have chosen instead?
I think I would be in the army or the air force. I am pretty like objective, and I'm pretty like, I like things when are done on my way. Like, okay, let's do this, let's do that, let's do that.
Mm-hmm.
So I feel like I would have fit pretty well on the Air Force or the Army. So maybe that's why I do critical care, because I like to be like on charge of things, helping people.
Do you have a favorite book or a favorite quote or even a favorite author? Do you read?
Yeah. So I have my favorite book actually is Dan Brown. I love Dan Brown. I know it's nothing about like things to be realistic, because it's like a lot of fiction in there. So I love Dan Brown. Why I love Dan Brown? Because it's like you forget sometimes of like what real life is happening, and you just like start reading and like get lost into like these angels and demons and like things that get lost so I love that kind of thing. I usually, when I travel, I take my books with me. I love traveling alone, by the way, and I feel like that's one of my buffers to all my stress. But yeah, Dan Brown is my favorite.
How often do you go to Ecuador and like leave the U.S.?
To be realistic with you, when I was in first year residency, I used to come like maybe every month. So I used to come like Friday, Saturday, and Sunday when I could. Then I started coming every 3 months. Now I still come like every 3 to 4 months. Especially, I don't have anybody in the United States. All my family is from Ecuador. So I'm alone there. So every time like I have like vacations, or if I have like even a free weekend, my plane is ready to go back home. So I think like I'm pretty thankful to like the position that I am right now. The place that I am right now, where I have like, I live closer to the airport. I can just like travel to the JFK and take a plane and visit my parents. Okay. So I always go. Never forget your roots.
Good to hear. Yeah, every month. That's pretty excessive. Yeah.
Yeah, exactly. Now I feel like at the beginning, because I'm pretty close to my parents, at the beginning it was like every month. Now it's like every 3 to 4 months. But yeah, never forget your roots.
Okay.
Never.
And what's your favorite thing to do back in Ecuador when you go and visit your parents or your hometown or wherever, like where you're from?
So I always go to, my parents have a hardware store back home. So the first thing that I do is like help them in their business. I love being there actually, because people saw me there since I was like a child. My parents had this hardware store for over like 20 years. So they saw me when I was like 13, 12, like they saw all my childhood and teenager years. And now they're like, oh my God, you're like so old. And I'm like, yes, I'm so old. So I feel like I loved having time with my parents. And then I love going to like small places to eat, like especially like chicken soup. Like the way we have the chicken soup is like very big portions of chicken. I love that. So going to eat with different places and visit like mitad del mundo, that is like the half of the world kind of area. Yep. I go to Galapagos, like traveling with my friends. Traveling with my friends would be like my favorite thing to do.
Okay. This is AP Med. My name is Andrew Poveda, and today we just finished interviewing Dr. Veronica Jacome Lopez. And a theme I would give for her is all it takes is one yes. And make sure you don't forget your roots, because you should at least travel back to where you're from once a month.